Hey, so I'm Ted. I'm a family doc, and I've been living in Washington, D.C. for about a year and a half, and I work half-time for the medical groups of Kaiser Permanente, the Permanente Federation, and the other half with these guys, and it's a lot of fun. And I like to put a fun image on the front, and in our work, we tend to make fun of California just because we can. I'm sure some of you do that too. But actually, this image is actually from San Francisco, and I loved it because it just shows what is the outcome of good communication. Because this is not about social media, it's about good communication. And often, when you hear the conversations, the spaces we work in, this is where the technology actually touches the patient with the doctor. And all of our jobs are hard, but this stuff really makes your head hurt. You know, you have to do this really well. And when you talk about stimulus, this is about making sure it actually helps a patient. So this is like really critical stuff. You have to think a ton about it. And this is where we want to get. Whether it was 1965 or 2005 or 2050, this will always be the same. And this is from my mentor, one of my mentors, Andy Wiesenthal from Kaiser Permanente, who helped lead their KP Health Connect EHR, which is pretty much done successfully. And if you look at that, you know, we're doing a lot of very fun and scary things to a lot of people or with them, and people really want to be involved. I've never met physicians that don't want to move into the future. I do meet physicians that seem confused about what the right thing is to do. I meet physicians that want more information, but that doesn't mean they don't want to do this. And so using the right tools is how you make these things happen. I'll talk about the EMR implementation I was in, and many of you will or have participated in. Initially, it's a lot of old school techniques like the weekly email, the newsletter, which has lots of implementations, which I'll talk about. Okay. I came from Group Health Permanente in Seattle, which is an affiliate of Kaiser Permanente, and our EHR project, was a $41 million project. Kaiser Permanente is about $4.2 billion. And we had a situation where we actually had a patient portal up very, very early, actually before the physicians got the full EHR. And so this is from our friends at Pew Internet and American Life Project, which are just down the street, and talked about the movement from patients actually needing to get information through brokers to actually getting it from where they wanted to. So we had a situation in group health where patients had free and unfettered access to healthcare information about their records, which was totally awesome. But, okay, I'm gonna think of this a little bit. But as a medical director supporting the implementation, I realized we didn't have the same transparency internally. So I was going from what I started doing is instead of rounding on patients, I started rounding on doctors. So I'd go to medical centers, and I'd get the same questions again and again and again, and realized it wasn't that they were asking bad questions, it was that we weren't informing them. So the newsletters always had good news. They never talked about when we made mistakes. They never talked about things that were coming up. People would sit in offices agonizing if they should send huge emails or not. It was just really, really difficult because we wanted to be respectful and informative, but not overwhelm people. And at the same time, I was in a leadership course through Permanente Medicine, where we were studying Southwest Airlines, great, you know, leadership heritage. And this quote from Herb Kelleher, the CEO, employees will be provided the same concern, respect, and caring attitude that we provide to the customer. And so what I was seeing in some EHR implementations is that we treat patients with incredible compassion, but when we look at the leadership of these projects, people are not informed at the level that they need to. Not because they don't want to, it's just time limited, and the methodologies we have are just too old-fashioned. So what a great place for social media, because people do want to stay informed. So I'm going to show, so what happened in 2004 was I asked permission to do a blog internally, and no one said no, but they just kind of ignored it. And then 2005, I said, I'll just do it. So I just did it. And still they ignored me. But what was really great, what kind of started to happen was when you do, this is a 900-person medical group. And there was an allegation that one of our specialty groups, orthopedic surgery, was not sort of playing along. And so I did the old world thing, going to the medical director and saying, can you just make them, you know, participate? And he did the cool thing and said, well, why don't you just go watch them practice for a couple days and see what the issue is? And so I did, and they welcomed me with open arms. They were really great, and I learned that there were a lot of things that we didn't do correctly in their implementation. So it was like a blended combination of lack of information, things were done right, we could have done better. And so I said, I will do this, but I'm going to write everything I saw down in this blog so the rest of the medical group can see it, good and bad. So I started doing that, and then I started writing a new blog post every day for 3 years. I think it was 748 posts. That's a lot of writing. We had 4 physicians on our team, and so I also asked them to post as well because they were doing projects like digital radiology, billing and scheduling and stuff like that. And 475 comments from a busy medical group is a lot. And a lot of those comments were not, great, have a nice day. They were really thoughtful issues. And when someone takes the time to go to a blog in a medical group in 2005, that's kind of a big deal. We did actually an experiment where one of the CEO of our medical group said, I have this problem with this certain part of Epic, what's the problem? And I said, I don't know. Let me put a post on my blog, can you link to it on your weekly newsletter? And that was the most hit blog post of all time. So the message there is people still trust their leaders, they do listen to them, and they want an outlet. And I learned in this experience that most people want 10% of the information you have 10% of the time, but you don't know when. So the nice thing about a blog is it's always there for them, and I would get tons of emails about, what are you doing about this? And I'd say, well, we posted about that 3 weeks ago, go take a look, which is great. Now I'm in an organization, Kaiser Permanente, where the scope and scale is almost unfathomable to me, maybe not to you. But we are talking about the jewel in the crown is kp.org, which is the personal health record linked to KP Health Connect, which is pretty much fully deployed. 75,000 new users a month, which is huge. Just surpassed 3 million in April 09, so probably the largest personal health record in the world. I think 5 million lab test results were viewed by patients online in the first quarter of 2009. The actual lab test results. So that's where I'm at. And so here it's less about moving the implementation along, more about creating an environment where leaders can behave in a way where people are informed at the right place at the right time. And enter the Disruptive Women Healthcare blog. What a great outlet, because Holly Potter, who's pictured at the bottom on the right, Annalisa Silvestre is the VP of Online Services for Kaiser Permanente. It's just a wonderful story about how Kaiser Permanente changed its approach to communicating with its community and itself. And I want you to read it because it's best there. And the cool thing about the Disruptive Women Health blog is before that we really wouldn't have a place to say it. It wasn't really suitable for like the Kaiser Permanente homepage. But and I have to be man of the month, which I want to be. I call myself honorary woman. And so it's great. It just talks about what Kaiser Permanente went through in the media in the Web 2.0 space in 2006 and how they responded. And Holly has been wonderful in changing the way people think about community relations and stakeholder management and permitting all of us to do amazing things.
And she's a disruptive woman.
She's very disruptive in a happy way. So just a couple examples. So Innovation Learning Network, which is Kaiser Permanente is part of, we went to the Steelcase Learning University in May where they have the healthcare line called Nurture. And as an example, Holly's team said, please tweet about everything. So what healthcare organizations would say do that? And then her team actually retweeted a bunch of it. So just very supportive of all of us. The default is what are we going to tell the community versus what are we not going to tell the community, which is great. Of course, Kaiser Permanente also has a YouTube channel. I want to put the link there. And again, before the era of Holly and YouTube, when you would pay for a commercial, the people filming the commercial wouldn't let you put it anywhere except on TV. So Holly's team started that process of licensing everything for broadcast on YouTube, and so now all their commercials are there. And I tried to get a rough cut of the upcoming commercial about KP Health Connect, but when Holly saw the list of people here, she said, you were too important. And so they want to have a big splash, and you would tell too many people because you're too big in the industry. So it's coming soon. And now, these are the first screenshots ever that we would want to show of the budding internal social network of Kaiser Permanente. So just 2 screenshots. So again, we're trying to figure out how we can leverage each other. We have 160,000 employees, 14,000 positions, $40 billion in revenue, 8 regions in 9 states. So you can imagine there's a lot of innovation happening all the time, and people don't get the chance to talk to each other as much as they want. Email has limitations. So this is called Idea Book. This is my profile in Idea Book. It has a lot of social media-like features like Twitter feeds, and I have a blog there, and you can friend other people in the organization. So one interesting thing about it is because we all work together, you can't approve or deny friends. You just become friends on that. So different constructs like that have to happen when you're doing this. So it's really new, and we're trying to experiment what's the analog in an internal organization about how to use these tools. At the same time, Holly team and us are also using all the external tools to their full advantage. And here's one community. It's the web-based training, developer training, and support community on IdeaBook. And so it's a great place for people across all the regions to share best practices, have them linked, document management, et cetera. And this will be eventually folded into the internal intranet, which is being reformulated as we speak. So more to come on that, but just want you to know that some of these large organizations do embrace this and want this to happen for all of their employees. And I think I'll just stop there and just say that really this is what it's about, is involving as many people as possible in the creation of the product. I love, well, one thing about DC, we have Library of Congress here. They put all their photos on Flickr to be used, royalty free. And so this is just an image of a mother, I don't know if it's a mother, but mothers and sisters building planes in the 1940s. color, beautiful color images. But just to remind us that everyone is necessary to make health care better. It's not about doctors and nurses anymore. It's about everyone involved.